because a client was like, hey, they told me I needed hip surgery and you helped me. They're saying the same thing to my dog. Can you help my dog? And I was like, I don't know. Bring your dog in. So I worked with the dog and the dog got better. Everybody has muscles and muscles get tight. And when muscles get tight and press on nerve, they cause problems. And if you can change that muscle memory, then they feel better.
Hi, this is Dr. Derek Taylor. Welcome to the Taylor Method for Pain-Free Living podcast. I'm here with my special guest, Stephanie Hunter. Stephanie Hunter is a pain relief expert and inventor and developer of the Hunter Method, which is a very innovative, unique approach of getting rid of people and dogs' pain using her proprietary techniques that she has come across and developed over the past 31 years plus. And so we are so excited to have you on our guest here on our show, Stephanie. Thank you and welcome to the show.
Thank you. Thank you for having me.
Now, you have been you have been a practitioner that has helped tens of thousands of people over the past 31 years in Jupiter. Now you just recently relocated to Chattanooga, Tennessee. You can see that in the background, the beautiful background there. And so you have developed this unique proprietary method of helping people and dogs get rid of pain using your method. How did this all come about?
It came about really because I was in a lot of pain. And when I was growing up, I was a gymnast, and then I got into cheerleading.
That says it all right there. Gymnast and cheerleader, you're going to have some issues here on the falls.
Exactly. And then I was in 17 car accidents in 4 years.
Wow.
And after that, I just thought it was game over. And I was really desperate, and I got down on my knees and prayed and said, God, please help me. And I got off of all the medications and all that stuff that was really, really hindering me and making me severely depressed. And I just thought there's got to be a better way. So I searched out natural methods and started my journey, went to massage school, and I was just obsessed with trying to figure out a way to get lasting relief. I wanted lasting relief. I didn't want to be on medications or anything. And so I just learned it all, did it all, and kind of kept putting it together and helped a lot of people along the way. And that's how I've gotten to this. But it was really Tony Robbins in 2013. I met him, and he just wrote one of the best-selling books on alternative health, and is the biggest health nut I've ever met my whole life. Like, take it to the next level. So when he met me, he's like, I love healers like you. And I don't like the word healer. I always feel like people heal themselves. I kind of help. But anyways, I didn't say anything. And then he said, I'd love to have you work on whatever. So I started working with him. And then about 6 months later, because I said, you haven't had this and you haven't had me. And that's when I started working with him. And then halfway through a treatment one day, he grabbed my hand and he said, like, you got to figure out what you're doing, really figure it out, train other people, and get this into the world. The world needs this. And so that's what I've been doing since 2013. So I've trained other therapists, and this has kind of morphed into also helping dogs. That's what I have right here. You can kind of see his that's Mr. Baxter. But dogs get pain too. And so I adapted my therapy because a client was like, hey, they told me I needed hip surgery and you helped me. They're saying the same thing to my dog. Can you help my dog? And I was like, I don't know. Bring your dog in. So I work with the dog, and the dog got better. That was like 9 years ago now. And so now, like, I teach people how to help their own dogs. So kind of cut out the middleman, right? The healer. Yeah. I believe everybody has a unique gift of being able to heal. We all have these amazing hands, and I've been at this for 31 years. So I'll be 58 this year. And I've done 94,000 treatments in my lifetime. So I just want to like pass the baton over to everybody and show them how powerful they are. It's not just the healers in the world. We're all healers. And especially if you have love, you can help your animal. You just need to know the right technique and whatnot. And I can teach that. So
Well, Baxter's right there. Why don't you show us a little bit about what you're talking about here as you teach others how to help their, I mean, we can have a whole show just on your human practice. But I thought it was interesting that you have this passion to help owners help their dogs. There's so many people that have dogs, and I just thought that's so unique, and you're pretty passionate about it. You've been doing this now for 9 years, and you've seen the incredible results that people have had with their dogs and whatnot. And so while you're there, why don't you just tell us a little bit about the Hunter method and how it works, and in particularly on this case here with animals, and Baxter being right there in front of you.
he likes your voice. He's like just like cuddled in, like, oh yes, Dr. Taylor, tell me. It's funny if we say HUNTER time, he can't spell yet. But if I say that, he'll start going berserk because he knows maybe he can spell because he's but so the easiest way just to explain Hunter method is that it's a touch and movement technique that changes the muscle memory. And so the muscles go back to their original state before they got scared, whether it was an accident, an overstretching, or whatever. So using touch and movement lets the brain know that it's safe to move. And so the person or the dog heals themselves. It's not me, the practitioner, that's like trying to go really deep or trying to get the right stretch, because if we scare the muscles, then the muscles are just going to stay to where they are. So like what it looks like with humans is the client is dressed and the therapist acts more like a coach and moving and touching their muscles. And that's like the simplistic version of it, but it's a touch and movement technique. So it's an interactive muscle therapy. I Googled that the other day. I put it in quotes, interactive muscle therapy. And the only thing that comes up is my stuff. So I'm just always hands-on. I don't really like spend much time on the computer, but interactive muscle therapy. So when I look at a dog, come here, Baxter, come. When I look at a dog, can you lie down? It's hunter time. Hunter time. Good boy. Hunter time. So when I look at a dog, I just look at it like a little human with fur. Now Baxter is, I don't know if I can move this without knocking everything over. There we go. But Baxter is 100-pound Mastiff, and sometimes he really wrecks himself because he works. You can see he's like, oh, we're gonna do hunter time. So what am I doing right now? I'm petting Baxter, right? So that's a beautiful thing, and we all pet our dogs, right? But when you do the hunter time, you actually, and I just pretend, I adapted my human stuff for dogs. I'm kind of like having to lean over here, but I'm gonna touch and move him, and just like I would with a human. This is his little scapula here, and I'm behind here, and I touch and move just like I would a human. I know. Do you want me to keep going? So and even like what what he's doing right now. We do a lot of stuff with the jaw, and he see his big mouth is so funny. Well, you can't see his mouth, but anyways, we do a lot of stuff with TMJ, and he's got such a big jaw and everything that when you start going near his mouth, he starts opening and closing his mouth. But here it's like, but you use the touch and movement. And so if I was working his chest, I do the chest muscles, and I go backwards, and I go through the whole body like that.
What are you
And
feeling for with your hands when you're on the muscle there as you're moving the leg?
yeah, so I'm looking for any kind of tightness, but the focus is that you do the whole muscle and feel for things. And with, you know, like with humans, sometimes a human won't tell you if something hurts or if you're on the right place, right? But with a dog, they tell you right away. So that's a really good thing. So when I teach dog parents how to work on their own dogs. So if I was going to work, so instead of petting, right, I'm just having a little bit of a hard time with wanted to show you in the video without, you know, but if, so he's just playing right now. So his nickname when he was younger was Piranha, because he lives through his mouth, right? But see how I'm moving his neck now, right? You can see that good. So
Yeah.
I'm moving his muscle and I'm moving his head, and he's entertaining himself with my hand. Good boy. Yeah, good boy. So he's had some real, I know. So he's had some, one time, about 6 months ago, he was, as my husband calls it, a three-legged dog. And, he's kissing me. And so I said, well, let's take the dog to the vet just to see what other people go through, because he's like, he knows if we'll just work on the dog will be fine. So we took the dog to the vet. He's 100 pounds. He's 93 pounds. So not yet 100, but he's a big muscly boy. And, so they did the drawer test and they straightened his knee as farther than the knee wanted to go. And, they said, oh, and he had a reaction, and they said, oh, he needs surgery right away. We got to get him right away. And I said, well, did we do an MRI? And they said, no, we don't do MRIs. I'm like, okay. So what are you seeing? And she's like, well, there's a fusion on the knee and there's contralateral indicators. And so we need to do this surgery right away. Otherwise he's going to get arthritis in the future. I'm like, okay, so you're going to what? You're going to put a metal plate in with screws, and and the joint was made incorrectly. That's what she told us. The joint was made incorrectly, but they're going to shave and alter the joint. So I'm thinking, did God make junk? You know, dogs' knees are bent. That's how they're made, right? So I did not act like I was an expert on anything. I was just asking, I tried to put myself into someone's shoes that doesn't know what I know, right? I said, so the effusion, so there's some water on the knee and he's favoring his other leg. And so you think that warrants surgery right away? And she says, oh, definitely. He's blown his knee out. And I said, well, what about wolves? And she said, what about wolves? I said, do wolves need to get surgery too? And she says, no, they have different biologic factors and whatnot. And I'm like, oh, come on. Like, anyways, I worked on the dog twice, and it was his butt, right? Also known as the ass, and his psoas, right? And those two muscles were tight. And once they weren't tight, then he was fine and he was no longer limping. And he would have been crated for 8 weeks. And they said, as soon as we do that knee, for good measure, we'll do the other knee. And it's $5,000 cash. And that's it. And you have to have this done. And so I've saved so many people from that. And I'm not saying that the dogs never have to get knee surgery, but any doctor or vet that I know, always, the good ones always say, do everything alternative and natural first before you do surgery. All my good surgeon friends, they all say the same thing. They want people to get better naturally. They tell their clients that, their patients that. So, and he works at the car shop with my husband. So he runs around all day with tires around his neck, and really, really athletic. And I'm going to find the papers on that. I'm going to ask to have them release those papers, because and then but made me think of it, because you said, what do you feel? And I said, hey, do you think it could have something to do with tight muscles, maybe pressing on the nerve? And she went like this. She took a finger like this, and she just touched the dog's muscle like this. And she said, no, I mean, maybe the muscle is tight because the joint is blown out, but otherwise, I'm sure it's fine. So anyways, palpation
Oh.
skills, can be taught, right? And, so I'm actually, you want to do this one? Ma, 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 ma. See, I don't know, can you see his face? Yeah. So he's letting me touch his little jaw in here, and he loves this because he's always, so I'm just palpating his masseter, and he's falling backwards. So you want me to keep doing it? I know. I know, Mr. Piranha, Mr. Baxter. So, but my vision is to help people everywhere. And it's not just people that like dogs that are limping or in pain. Arthritic dogs, dogs with hip dysplasia, they're just congenital things they're born with. And then instead of just petting, to be able to do the touch and movement and help the dog, and they love it. And he lives on this massage table and just stares at me like, "Mommy, how about some hunter time?" And even like teeny tiny dogs. So people say like, well, your dog is so big and athletic. Well, what about my little dog, right? It's just like people, I'm sure you see a lot of football players, and then you see like, very tiny women and, in their 70s or whatever. So that everybody has muscles, and muscles get tight. And when muscles get tight and press on nerve, they cause problems. And if you can change that muscle memory, then they feel better. And the dogs let you know right away of what it is that, they feel. And so I think I told you, like, so starting October 11th, Wednesday nights, I'm going to show up live on a Zoom, and we're going to do a Hunter Method for Dogs masterclass every Wednesday night at 7 p.m. So you bring your dog and you turn the sound off, and I'll have the tech set up so, you can easily see me working with the dog. And by the time you get off that call, you will know one area of the body, one move, one whatever, how to do it yourself. So then you can go on and help your own dog. I have the videos are online. You can buy them today. They're great. But I know a lot of people are busy, and to say you're going to get on there and watch the videos and go through it, it sounds like you're going to go get a master's degree. So just easy peasy, signing up, every week, and they'll be recorded. So if you miss it, you can follow along, after. And
so you're saying that the dog lets you know where to work. Is that by them? You can see that they're responding well to the treatment or whatever you're doing, and they're enjoying it. Their eyes are closed. They lean into it. What do you say when they let you know? How are they letting you know that you're working in the right spot?
Exactly what you're saying. So all these like body clues, they're breathing, and I teach all that too. Like and sometimes, you're working in an area and it's a little tender, but you can work it so gently that you can work it, and exactly what you're saying, like the dog will lean into it, like you said, and let you know. I mean, when like there's a move that we work along the spine, and you can feel, even if you don't have a real strong sense of feeling with your own hands, the dog will really let you know, and step by step, moment by moment, and they love it, and so they'll let you know. Yeah, but I teach all that, so it's kind of yeah, and that's why they're easier than humans in a way, because let's say somebody thinks you're, they go to you, you're the expert. So instead of saying like, wow, I really feel that, or kind of making a face or anything, some people are like, I'm not going to make a face. Now, I don't, sometimes I say like, you do feel this right now, right? Because if you don't, we have other problems. And
right, yeah.
So, but that kind of like, I'm gonna take it because they're the expert. The dog is like a moment by moment animal, and anyways, it's such a bonding experience to do it with your dog, and I've
And
taught a lot.
how long do the treatments last typically? I mean, how long does it take for you to work on Baxter when you do a hunter method treatment with him?
It can be anywhere from 10 minutes to 25, 30 minutes if he was, and it depends on like how bad they are,
Mhm.
and um and then the other thing too is that if the dog is sitting next to you and do you want to say hi to Dr. Taylor?
Mhm.
You see something outside. That if you're gonna just be petting a dog anyways, like sitting on the couch, you can work in like 5 minutes here, 5 minutes there. And so getting some relief instead of, so it doesn't have to be like a big set thing like hunter time and and not like a big moment in time, that it can be really done a little bit at a time. And then in terms of like lasting, he is not limp now in however, I don't have any sense of time, but my guess would be about 6 months ago, where he literally could not put any weight on his foot. And in a matter of a few treatments, he was better and he's been fine. Now, 6 months from now, he'll probably start limping again because his muscle will get tight again. But then you know exactly how to fix it and work on it.
Right.
And
What is it that's making Baxter's muscles tight in the first place? Is it just the running around, the wear and tear on the scar tissue that's created, or just the stresses of what dogs do? What is it in your
yeah, I think
that
that's just,
contributes to the tightness?
yes. A lot of it has to, that's why I would explain. I'm working on a little a webinar called "Why Am I Still Hurting and Tight Even Though I'm Doing Everything Right?" And part of that is about how we get tight in the first place. But let's say he plays really hard, he runs down the hill, slides down the hill. So if he's a little bit, if a muscle gets overstretched, that's one reason to get tight, because the muscle gets scared. So the receptors, the body is covered with millions, and I know you know all this, I'm just telling everybody here. But the body he feels my touch because he has receptors, mechanoreceptors, pressure receptors, chemoreceptors, baroreceptors, all these little receptors all over his body sensing the environment. So let's say he's coming around the turn and his foot gets, into a hole and his leg keeps going. That muscle is going to get overstretched. And if it gets overstretched, then the brain will say, tighten up, something happened. We got to keep him safe. And so then just going through life, muscles can get tight, or being in a weird position. Like he works with my husband and goes to work every day. And he might fall asleep in the back seat in a funny position, and he might get tight that way. So but that's just part of life, right? Or being really tired and doing something anyways. He'll be so tired, but he'll still want to play with that basketball. And so I'll never really know, but I just know that he gets tight muscles and then they start to bother him. So, right.
And so you're releasing that muscle by taking the tension off. You're like basically you're helping the muscle tell the brain, hey, it's okay for you to relax. You don't have to be tight anymore. That memory that's stuck in the muscle there now can be kind of, hey, it's okay, it's released, and you're moving it at the same time while you're working on it, I see.
Yes.
And so all of that is just causing that connection to get reestablished. Is that sort of what's happening here?
Yeah. So you think of like, so if I touch here, the brain knows that right away, right? So the muscles talk to the brains talk to the muscles. And so I'm trying to, and it's also energetic. With even thoughts, when Tony said, figure out what you're doing, I thought, okay, I'll teach all of it. Now, I honestly don't know which part is the most important, but I'm trying to give as much information to the body to say, hey, it's okay, you can move. And so I'm moving. I'm moving the muscles, and so it's like, you want to show? You want to show? Usually he's laying down. Hi, hi. So anyways, I'm moving the opposite muscle. There's all these different things I'm doing, but just exactly what you said, that I'm trying to get as much information to the brain. Hey, it's safe to move. And from everything from talking to the muscle in my head, talking to him in my head, moving the body part, touching it in a special way, and just letting the brain know that it's safe to move. I mean, I would add something to it, tomorrow, like so I do the same thing with humans. People come to me and they say, I haven't been able to raise my arm, for 10 years. And so I'm moving and they're moving. It's interactive. Now with the dogs, they don't move on command, right? So a lot of this is done passive movement, but they actually start to move once you start moving them. It's almost like they understand what you're doing. And so there's that's why I call it interactive muscle therapy, because there's so much movement going on. And then once the brain gets this signal, and a lot of it too is how you touch or whatever. It's a fascial touch, it's a energetic touch, it's I'm a myofascial practitioner, a polarity practitioner, like you name it, I've studied it. And if you broke apart every single thing in my work, I've learned it from somewhere. So it's like everything I learned from somewhere, but I just put it together in one thing. And the one thing that I would never do to a human or an animal is to stretch them hard in any way, because I don't know where their stretch receptors are going to say, hey, that's too far, right? So even though my background was gymnastics, I'm very stretchy, very flexy or whatever, flexible. I don't overstretch, I don't stretch, I don't do any stretches, and I just do dynamic movement before an activity, and not that. So trying to stretch your dog, that makes the dog tighter too. So so that's why it's very gentle movements and touching, that it's
and when you're moving the part, you're moving it to the amount that the body's letting you move it, correct? It's like you're never overdoing it or taking it past where the body wants it to go.
Exactly. I mean, I keep it in such a small range, so right now you think like, am I petting him? No, I'm working on him, but he doesn't know, I mean, just I'm touching him and I'm moving his head, I'm moving away, and I'm touching his neck here. And so
And when do you know when to stop doing that?
I've kind of, because I've done it so many different ways. I mean, I did 100 touches. I did, so it's like 2 sets of 10, on an area. And that's what I aim for. 2 sets of 10. And then you come over here.
Yeah.
2 sets of 10. And then you can he likes his treats. And he's gentle. So yeah, that's a really good question. And so I aim for 2 sets of 10. But
and then when do you know when to work on the body again for the dog?
Well, the thing is, if they still have, like with the dogs, I work on him when I have a minute, just sitting next to him on the couch. Or
Well, that's one lucky dog, I tell you.
yeah, he is a lucky dog. And it's funny, if my husband's getting a treatment, then he'll get so upset. I have some funny videos of him like, Daddy, it's my turn. And really funny. But I think it's like, just like little, like if your dog is like, seems more lethargic, whatever. But to me, it's just working it into your day of what you would do. And then having like a 10-minute hunter time kind of thing. is really nice. We have a massage table set up in the house all the time, but it's like,
Great. Awesome.
you can use a couch, you can use the floor, you don't have to get so fancy.
Yeah.
But it's just like with humans, we do 5 to 10 treatments in a 2 to 3 week period. And some of the harder cases I've had, like would be like a 6 month, 6 month case. I had a man that he was a quadriplegic, shot in the neck twice. And they said, you'll never move again. And he has full movement in his upper body, his hands, every single finger, everything. So like that was a harder case, but most of my people, even if they've had it for a really long time, it resolves pretty quickly. And then I get another client. I see a new person.
So if you have a dog, let's say they have a couple of different areas that, how do you know where to start? Which part you're going to work on first? Does the body kind of tell you where's the priority, or you just kind of go by feel, or how does that work? So
I think like with dogs, like the easiest, so in my class, I'm going to teach one area. So you get really proficient at that one area. And then creating like a little routine to be, because they're not that big, not much, not many moving parts, that you can really go through and give a whole body treatment and just see what you find. Because like if a patient comes to you, they're going to say, doctor, I have this, I can't raise my arm. They're going to tell you, right? And so with a dog, they're not going to tell you. So I think just creating like a little routine, and then you get to know your dog and say, hey, his chest and his arms are usually great. And it's when I talk about a dog, I don't say front legs. These are the arms. This is shoulder. This is the like just exact like a human body. So you don't have to know anatomy. One time I committed to memorizing all the dog muscle names, and it's like that was like short-lived. They're really long, and so chest muscle and this and that, and this is their butt, this is their jaw, this is their, I don't think I remember one muscle name from that thing. But
well, that's fascinating. So this is exciting. So here in less than 2 weeks, and you're going to be having this. How can people get a hold of you, and how can people take this course and sign up for it?
Well, you can go to huntermethod.com. That's my website. And huntermethod.com. And then in the upper left-hand corner, it says programs. And there's one that says dogs. There's other ways to access it too. And then you'll see the dog course and kind of scroll through that. And then you'll see so it's a subscription. It's $97 for the month. And it's going to be 4 live calls and all the recorded calls and all the like downloadables and everything. I'm just committed to teaching people how to do it. And I think that's the best way, because then you're there with your dog and you can ask questions, and you'll just learn it a little bit at a time. And within a month or two, you'll be proficient and this and that. But just the social aspect of having everybody, have their dogs on there and seeing everybody is fun. I know that my husband always says, I don't trust people who don't like dogs, and I kind of agree. So, so just huntermethod.com. There's a little link on there, $97 for the month. It starts October 11th. That's a Wednesday. And if you have any questions, there's a contact us form. That's all it is. And that goes right to my email, contact us. And so if you have questions, I can respond that way too. But I think the biggest thing is just give it a try. You cancel anytime, it's fine. We're just here to serve. We're not
I love it.
Yeah, this is I have a few jobs already. I just like want to be able to give what I know to people so they can help their animals just have just a better quality of life, so.
Yeah. Oh, that's fantastic. Wow. Well, thanks so much, Stephanie, for taking the time out of your super busy schedule to be with us on this show. And I'm going to look at my schedule and look at clearing that out myself. I'd like to join you on that Wednesday. And I have a dog. We have a golden doodle,
Oh,
and
I love those. Oh,
yeah,
I love those.
her name's Callie. She's a great dog, but anything to help your pets, experience. Maybe they don't tell you when they have pain, right? They can't complain here about it, and also, why not just keep their bodies tuned up? And you've developed this incredible method of doing that, and you're so generous in sharing it with the world like this. And so, thank you for taking the time to be on our show. And how can people get a hold of you? Let's say yes, you work on those, but you also work on humans. You have people that fly from all over the world to come see you. Or there's people in the Tennessee, they're so blessed to have gotten you now. They stole you from Jupiter, Florida, and now you're out there. How can people get a hold of you if they wanted to just have a private session with you? Are you still doing that? Are you accepting new clients still? Or I know you're pretty booked up. You just only been there a year, but your schedule's already full. But do you still see new clients?
I do. And then I also have a great gal that works with me in Chattanooga,
Okay.
and Julia, and she's very talented. And then I have a couple people in your area. It's just
Okay.
that they're also very booked up. But so if you do the contact us form, we can
Okay.
hook you up like that.
Great.
If you're in Chattanooga, go to the center page and there's a little link where you can actually make an appointment.
Okay.
Sometimes people, if they have harder cases, like they've had Parkinson's or MS or just things that people can't help, just to fill out the contact us, and then people sometimes fly in for an immersion.
Yeah.
They stay with us for 1 to 3 weeks. So I do 1 or 2 people like that a week. And sometimes in your neck of the woods, but I'm usually working, and I miss, if you're from Jupiter, hello, I miss you. I love the people in your area. You're lucky to be there. Just great people. But yeah, so just mainly the I'm sure but my website's always under construction somehow, but there's links, and I love that contact us form because you can send a message and then get back to you. But like with this, we're also starting a women's class for women with neck pain, TMJ, migraines. That's Tuesday morning, starting on the 10/10 at 10 a.m. And I'll be doing a live class with women. And so you can read about that on the site too. But thank you so much for having me with your people here. And I really appreciate it. Like, I love what you're doing.
I found you because one of my patients came to see you. She had a lot of she was referred to me, and she came to see us, and she said, I've been to so many different people trying to resolve it, and the only person that was able to help me was Stephanie Hunter. And then she moved to Chattanooga, Tennessee. And so I said, I gotta talk with this lady, and we got to get her what she does out, because it sounded like what you did was intriguing, and certainly it is. And now you've made it available for people to learn this. And so, wow, what a blessing that is to others. So thank you so much for, again, sharing your time and being on the show. Really appreciate it.
Thank you. Thank you, Doctor. I appreciate it. And
well,
Baxter, so good.
Yeah. You've been on the Taylor Method for Pain-Free Living podcast with our special guest, Stephanie Hunter, pain relief expert and inventor and developer of the Hunter Method. You can go to huntermethod.com, and you can reach out to her that way if you'd like to book a time with her, or if you'd like to take her class and learn how to work on your dogs. And so thanks again, Stephanie, for taking the time and being with us today.
Thank you. Say bye. Bye.
Bye, Baxter.
Bye. Thank you.
You've been listening to the Taylor Method for Pain-Free Living podcast. We hope that you found great value in this episode. For more information about the Taylor Method and our offices, visit www.drderektaylor.com. Make sure to tune in next week, as Dr. Taylor will be providing more knowledge and resources about pain-free living.